out. The position is masks will be optional this evening for all crew and passengers as well.
They are free at last, thank God Almighty, free from the mask. Passengers and airline employees rejoice the moment they learn their masks are no longer mandated on airplanes. Same goes for mass transit too. But could the celebrations be short-lived? The Biden administration will appeal a federal judge's ruling since the CDC believes that masks are still necessary for the public and something one of our guests or some of our guests agree with.
You know, we really have to still continue to take safe precautions. You know, we've gone to the point where we're at right now because of us practicing those safe measures, the masks, the vaccinations, and generally speaking, the country has done well in helping us reduce these numbers. And so we've gone to a point where we're at now because of that reason. We need to continue to be mindful of that. And, you know, now it's really up to us as human beings, as individuals, to make the right decision, make the decision that we're comfortable with. You know, some folks may be at a more vulnerable because of medical conditions that they have. And so because of that, you know, and also some kids haven't been vaccinated. So those are all reasons that everybody needs to make their own individual decision and then carry out on that decision.
What would be your advice to the traveler out there now if you could talk to them? What would you tell them? Wear a mask, not wear a mask? Your thoughts, especially in enclosed areas like airplanes, and obviously there's circulation of air, but we're talking about buses, airplanes, the way we travel in this country.
That's correct, Isaiah. You know, it's really a personal decision now because we've seen such a push from the political side, from a public health standpoint. It's a mask. You know, you're doing your job of protecting yourself and protecting others, you know, especially if you're around those that are vulnerable, that have other comorbidities, other medical problems, diabetes, blood pressure, lung issues. Those are all things that put folks at a higher risk to develop complications from this virus itself. Therefore, it's a personal decision. It's a personal choice to kind of act up. You know your body, you know, and also if you're feeling ill, if you've got any cough, fever, chills, you know, any of those that may say, hey, you know, you may have COVID or any other illness, then yes, it doesn't hurt you to put that mask on and to travel to protect yourself and to protect others as well.
Armando, I know you travel quite often. You're often flying. Your thoughts on the government saying that you don't have to wear a mask? It's optional. It's your choice.
I think it should have always been like that, to where you could be able to wear it as your choice, because if I want to get sick or if I don't want to get sick, that should be up to every individual citizen in the United States. And that's anywhere in the world. But a lot of times it's a hindrance, and especially with traveling, with now you need your antigen test, your mask. Like, it's so impossible now to try to travel. But a lot of times, if you're going to get COVID, you're going to get COVID. You know, nowadays, it seems like with the mask mandate ending, that's not going to stop the criminals. The criminals are now using the mask more than I think COVID is. It seems like every robbery or every crime that's being committed, all the, you know, crimes that are being committed, they have masks on. So, you know, the thing is that where we're going to draw the line to where if we need them, if we have to wear them, or to make them illegal, because, you know, I don't want to be approached by somebody wearing a mask at, you know, midnight. You know, I know what they're up to, and that's just my opinion. But a lot of times, like I said, if we are in a situation to where we go into an airport or go to a store or go to a football game, we want to have that freedom. That's why we're the United States. You know, we're number one and with freedom. But, you know, if anything, it seems like our rights all over the world are getting taken away little by little. But like I said, this is a free choice to do what you want. And the only thing that I think with preventing anything, it would prevent from any type of flies going into my mouth. So, like I said, that's what it will prevent you. Yes.
All right,
if anything,
let's hear
that'll
from you.
protect you. All right.
Ms. Hillary, let's hear from you.
I don't know if I can follow that, but I'll say this. In all my living, I have never met the human being who will fess up to having a cold. Everybody, oh, I just have allergies. I know that I coughed right next to you. It's just allergies. The mask stays on. If I'm flying, I don't care if the government says it's mandatory or not. I am masking up. After this last flight that I just took to El Paso, not even 2 weeks ago, there was zero space between me and the gentleman next to me who coughed and hacked the entire flight from Houston to El Paso. And the man snorted and sniffled and sneezed. And I knew it was not an allergy when he pulled out the cough drops. No, I cannot. So I actually like the masking idea because I also have the right to stay healthy. You can feel how you want to feel because I am masked up next to you. No, I am not robbing you, but you're not going to rob me of my good health because you want to say it's an allergy when we all know it's a cold. So I'm going to stay masked up on a plane where I have to sit this close to somebody else.
Still to come, things get more interesting when our conversation picks up after the break. We'll get to what led to this comment that had two of our guests reacting this way. Take a look.
I'm just happy that the cold came back again because, a year and a half ago, everybody thought you had COVID if you even showed symptoms of a cold, and they never differentiated, and they never separated those actual facts that, cold was, automatically disappeared. But now it's starting to come back again.
And welcome back to The Factor Uncensored. Tonight we're talking a federal judge's decision to end mask mandates on public transit and airlines. While the majority of folks seems to be thrilled about it, my guests aren't totally on board. Some say they still will be putting on those masks when they travel.
As for me and my house, we will wear the mask. All right. And we're especially going to wear the mask because we don't trust people who say that they're not sick. So I am with my sister. I'm going to be cautious. I'm not running around here talking about all of my rights. My right is to stay healthy and keep as many people healthy as I possibly can. So yes, I've limited my airline travel. I have some things coming up probably in July, and I'll be watching the numbers very closely to make that decision for travel in July and August. But otherwise, I'm going to keep on Zooming it. I'm enjoying this just like this. I'm not even coming to your studio.
And Amanda, what about what Dr. Ruth says? She has a right to be healthy and not exposed to you because you said you just have a right not to wear the mask. Your thoughts on that?
Well, everybody's right is to be healthy, but at the same time, being healthy comes at a price. Like, for example, especially if you go to McDonald's, you get $1 hamburger compared to a, $8, $9 salad. That all comes down to health, but those play into factors with you possibly getting sick, especially with weight. And there's other issues that could be underlying issues that you could have that could get COVID. But, like with me, I'm a pretty healthy individual, I would say. I have gotten COVID once before. Did I get it 3, 4, 5 times? No, I didn't. And I respect people that get the COVID shot and the booster shot. But if the pharmaceutical companies, which have profited billions and billions and billions and billions of dollars, they make it a third booster shot, 8th booster shot, and people are still getting sick from COVID, then what is the real reality? Because we're still getting sick with masks. We're still getting sick with, COVID vaccinations. So we're getting sick general, but then also, I'm just happy that the cold came back again because, a year and a half ago, everybody thought you had COVID if you even showed symptoms of a cold, and they never differentiated, and they never separated those actual facts that, cold was, automatically disappeared. But now it's starting to come back again. And still, like I said, there's ways to protect yourself. And I agree with anybody that wants to say, hey, if you come to my house, I don't want you to get me sick or get any of my family members sick. I totally agree with that. So if I was to go to my brother's house and, he says, hey, put on the mask, I'll probably just leave. But, you know what I mean? Still, at least he made an effort to try to save us.
And
That's
Dr.
an
Ali,
interesting guy.
Really quick, Dr. Olson, because we don't want misinformation out there. Dr. Ali, when we talk about people who get COVID after being vaccinated, the point is people are not dying from it in high numbers after getting the vaccination, right?
That's correct. We've seen a 99% reduction of the severity of those symptoms. A lot of those folks do not get hospitalized. A lot of them do not die. They have mild to asymptomatic symptoms. And going back to Armando's point about this, you know, I'll tell you, we're in this position now where we've seen such a reduction of cases, deaths, and if we were not practicing these safe measures that we have been for the past 2 years, I think we would be in a much worse condition. We would still have hundreds of thousands of cases where we're at 30,000 now. We've seen such a reduction in hospitalizations. And, you know, even though the deaths are still out there, we're seeing about 150 deaths or so a day, you know, but those can all be reduced, and they have been reduced because of the things that we've done. Nothing is 100% foul-proof, but these vaccines work. We've seen such a big reduction in those cases, and it's just shown how effective these medications and these things are.
And Dr. Ruth, I'll let you wrap up really quick with your comment.
Yeah, just all the clamor of my rights and your rights. You know, we got to take care of each other. We've got to get back to that. And this whole thing started out with a lot of confusion, and it got politicized. And my vote is for us to come back to caring about each other. I will lay down my rights for someone to be safe. And so that's how I feel about it. So thanks for having me.
And thank you all for joining us here on The Factor tonight.